Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, would like to welcome you all in my Ayurveda Academy YouTube channel. As everybody now knowing that Professor Deshpande is MD, authentic doctor in Ayurveda, Ayurvedic medicine, of course, the Kaya Chikitsa, and second, my MD is in Ayurvedic physiology, that is Priya Shari. My dear friends, I have the very good team of the doctors, Ayurvedic doctors, and we are working together for many projects. So if anybody of you wants the treatment, any disease from cold to cancer, please don't forget to contact on WhatsApp 92268 10630. But please, in spite of the phone, I request for the WhatsApp number is given in the description. Now we are making a particular serial Ayurveda in GP, that is Ayurveda in general medical practice. And today we are discussing the 21st problem in general practice of medicine, that is gynec problems in GP, general practice. Gynec problems mean the feminine problems, especially the problems related with the female reproductive system. And Ayurveda says basically the female has a much more responsibility of reproduction. And for that reproduction purpose, the God or the divine nature has given us the important organs like the uterus or the garbhashaya. Uske साथ साथ that means she has the ovaries where the ovum or the female gamete or the stree bija is generated, and which is ovum is united to the spermatozoa and the fertilization takes place. But these ovaries, they have the regular, what you can say, the hormonal cycle, and that hormonal cycle is meant for proper reproduction event. Okay, so for that matter, the menstruation is a very important thing in the female reproductive age or the female reproductive life. Then that menstrual cycle itself is sometimes problematic for that particular lady. So we will discuss the various problems related with the menstrual cycle, and we also try to find out some other things like, for example, the white discharge, or we are little bit discussing about the abortion cases, habitual abortion. My dear friends, I have also some videos related with the females or the female gender. Please look for the specific classes that I am taking for the students, and they are useful for the common man as well. That classes are called as a Stri Roga classes or Prasuti Tantra Stri Roga classes. So you can find out that particular playlist, and there you will get some interesting videos, especially infertility video is totally independent video, which is not included in this particular session. Let us start to discuss the feminine problem. This video may be little bit more extensive because of the lot of things to be mentioned, and then please keep the patience to see the video till the end. Let us see what are the common problems in the females. These are like that. First is a menorrhagia, excessive bleeding during the menstrual cycle. Normally, you know that 28 days cycle is there. It starts at the age of, say, approximately 13, 14, 15, etc. That period is called as a menarche, beginning of the menstrual cycle, and it will continue up to the age of approximately 45 to 50 years of age when the menses stops. That afterwards, that period is called as a menopause period. So menarche to menopause is called as a reproductive period. In the 28-day cycle, first 4 days are of bleeding. 3 or 4 days are there, and daily 2 or 3 pads have to be used. Okay, is it correct? And then after that 4 days, till the on the exactly 14th or 15th day of the whole cycle, there is a ovulation. And during that period, from the day, for example, 10 to the day of 18, if the if the husband and wife, they make the intercourse, then that particular female can become a fertile, or she can conceive, and the pregnancy starts. Okay, so menorrhagia is excessive bleeding, which is also called as a dysfunctional uterine bleeding. Okay, uterine, garbhashaya. Scanty menstrual period is another problem. Less menstrual cycle. Habitual abortion, repeated miscarriage or abortion, because there may be uterus problem or any other problem. And leukorrhea is a white discharge. So first we will begin our lecture with the menorrhagia. So first we will try to understand what is exactly the menorrhagia. That is called as a polymenorrhea or epimenorrhea. Too frequent menstruation at regular intervals of 2 or 3 weeks. Every 2 weeks, every after 15 days, the menstrual cycle comes. Ideally, it should come every after 28 days, but it is coming every after 15 days or 21 days. Such a cyclical bleeding can be normal in amount, but when it is excessive discharge, the condition is called as epimenorrhea. Now let us see what can be the causes of these epimenorrhea. See the causes. This is a new style I am following, making that portion very bold so that everybody can look and concentrate on that finding. Endocrine disorder, that hormonal problem. There may be hyperactivity of anterior pituitary gland causing the too frequent ovulation. You know that anterior pituitary has a connection with the ovary. It secretes FSH, follicle stimulating hormone, and LH, luteinizing hormone, that affects the ovary function. Okay, the group can be included under dysfunctional uterine hemorrhage, DUH or DUB, because of the hormonal problem. Constitutional disorders. If the lady is not taking proper food, she is undernourishment, malnourishment, asthenia, weakness, psychological disturbances, some tensions in the family with the partner, with the children, with the society, household problems or the service problems. Lot of stress may be there with the female. In some cases, 3-week cycle sometimes, very rarely, can be characteristic of that woman, and it may be considered as a normal. Pelvic disorders, chronic pelvic inflammation or chocolate cyst of the ovary is one of the causes for the epimenorrhea. Now we are talking about another type of the bleeding that is called as a menorrhagia. Intermenstrual, in between, this is 28 days first cycle, this is second cycle. In between that cycle, there may be irregular uterine bleeding. Irregular hemorrhage before puberty, even after menopause, is usually termed as a metastasis. These are the typical medical terms. So whenever there is excessive bleeding, it is a part of, in the Ayurvedic concept, Pitta dosha is responsible. Pitta has a property Ushna and Tikshna, hot and penetrating. Irritant property is there. So main, what you can say, the culprit, the problematic bioenergy is a Pitta dosha and simultaneously Vata dosha. But in the dhatus, there may be problem with the Rasa dhatu, because Tanya and Raja are the Upadhatu of the Rasa dhatu. Secondary tissues from the Rasa dhatu, that is the breast milk and the menstrual bleeding. So one may have the relation with the Rasa dhatu. Also, there may be anemic condition, relation with the Rakta dhatu. If there is a weight loss condition, tuberculosis, cancer, HIV, relation with the Mamsa Vahasrotas also. Okay, so basically it is concerned with the Artava Vahasrotas problem. Artava Vahasrotas is compared to the female genitourinary system. And also, you must not remember, in the Vayu, there is a Apana Vayu. Apana Vayu is on the lower abdomen and it is responsible for this menstrual cycle. So Apana Vayu Vikruti can be there. It may have some the problems with the constipation also. So try to understand the pathophysiology of this problem. Now, what are the causes of menorrhagia? Carcinoma, that is cancer of the cervix, or that of endometrium, that is the uterus. Uterine polyps may be there, or dysfunctional hormonal causes may be there, uterine hemorrhage that we have already seen. Now let us see another causes for this irregular bleeding. These are another causes. Any ulcer of the cervix, which can be called as a cervical erosion. Cervical erosion can be pre-cancerous stage in the ladies. Tuberculous endometritis. Tuberculous, TB is an infection with the genitourinary system. Disturbed early pregnancy, hemorrhage, that is abortion or tubal gestation, that can give this particular irregular bleeding. Breakthrough bleeding in oral contraceptives. The lady is taking OC pills like Maladi, etc. And when she stops, then there may be such type of the irregular bleeding. Post-IUCD bleeding, intrauterine contraceptive device. Intrauterine contraceptive device like copper T. After insertion of copper T, there may be such irregular bleeding. Now we will talk about another thing which is called as a menorrhagia. Excessive menstrual loss in amount. Every day, in spite of 3 pads, the lady has to take 6 or 7 sanitary pads, that is excess amount. And duration. In spite of 3 days, she is getting the bleeding for nearly 5, 6, 7 days. That is excessive in duration. This is a heavy menstruation. Menotaxis means the prolonged menstruation in duration. Menotaxis. Now let us see the causes of this particular excessive bleeding. Okay. First, pelvic causes. Uterine fibroid, garbhashaya. Pelvic inflammation like chronic salpingo-oophorytis. Salpingo is related with the fallopian tubes. Inflammation of that tube which connects the uterus to the ovary. Fallopian tubes. From ovary, the ovum is coming from the fallopian tube, enter into the uterus, and if it is not fertilized, gets bleeding through the vagina. Okay. Oophorytis, that is related with ovary, is the inflammation of the ovaries. Chronic endometritis, then retroversion of the uterus with chronic metritis, prolapse of ovaries, pelvic endometriosis, that is adenomyosis, chocolate cyst of the ovary, uterine myohyperplasia, that is fibrosis uteri, carcinoma, cancer of the endometrium, ovarian tumor, uterine malformations like double uterus. Now, next is the endometrial disorders. Dysfunctional uterine hemorrhage is an important cause. Hypothyroidism or hyperthyroidism can cause menorrhagia. So you will have to do the thyroid test. Okay. General diseases. In some cases of the, just wait, I will mark these points for you. Excessive bleeding. Some cases of chronic hypertension. So you have to check the blood pressure. Heart disease with chronic congestive failure, which is called as a CCF, right ventricular failure, or maybe left ventricular failure. Chronic nephritis, kidney problem, undernourishment, avitaminosis, B complex deficiency, vitamin C deficiency, defective nutrition, hepatic dysfunction. Liver is the biggest industry. So all the metabolic processes takes in the liver. So if your liver is damaged, you can get the problem. Blood disorders like severe anemia, hemoglobin normal 12 to 14 gram. If it is less than 10, 7, 8, that can cause the excessive bleeding. Leukemia, blood cancer, purpura, bleeding disorders. In Ayurveda, this can be compared with Rakta Pitta Vyadhi, Rakta Pitta. That is Adhoga Rakta Pitta. So that means in Ayurveda, it is mentioned that whenever there is Adhoga Rakta Pitta bleeding from the uterus, rather vagina bleeding, per vaginal bleeding, PV bleeding, or there may be bleeding through the urine, bleeding, PR bleeding, per rectal bleeding. So all these Adhoga Rakta Pitta type of conditions, if the patient is stout and sturdy, and if it is indicated, then Vamana can give the better results, because the Ayurvedic principle is Pratimargam cha shodhayet or Pratimargam cha haret. In Rakta Pitta Vyadhi, if the bleeding is from lower tract, you have to purify the body from the upward, like Vamana, therapeutic vomiting. If the bleeding is from the nose, epistaxis, hematemesis, then Pratimargam cha haranam, that in that condition, we can give the Virechana Chikitsa, purgative therapy. So this some basic understanding of Ayurveda you should have with you. Emotional disturbances like tension, sorrow, unwanted excessive sexual contact, partner problems, marital problems, drugs, medicines, prolonged use of aspirin, then anticoagulants, psychotropic medication, that can also cause the excessive bleeding. Now, dysfunctional uterine hemorrhage. This is the abnormal uterine hemorrhage where no organic cause, no systemic cause, no hematological, no pelvic cause can be detected. Now let us see what investigations are helpful to understand this problem of excessive bleeding, menstrual bleeding. Hemogram and ESR. By hemogram, you can get the hemoglobin, red blood cell count, white blood cell count. So when the hemoglobin is less than 12 gram per cent, it is anemic condition. Normal red blood cell count, you have to check it. Then ESR, chronic infection prognosis can be understood. Then WBCs are called as soldiers. So white blood cells normal 4 to 10,000 per cubic mm. If the count is more than 15,000, mild infection more than 20,000, moderate infection more than 25,000 per cubic mm, severe infection. Urine routine for UTI, urinary tract infection, you have to find out pus cells, maybe stone formation, urinary calculus can be there. So crystals will be there more in the urine. Then glucose, glycosuria, maybe because of the diabetes, you have to check it. BTCT, bleeding time and clotting time. Normal bleeding time can be considered as a 0 to 5 minutes, clotting time 5 to 10 minutes. Then by which we can get the understanding of the platelet counts and all the what you can say, the hemorrhagic problem, or the hematological problems, blood dyscrasias like thalassemia, hemophilia, purpura, idiopathic thrombocytopenic purpura. All these things we have to consider when we are treating the female. Endometrial curettage for the Cox infection, TB, Mycobacterium tuberculosis, malignancy, cancer, detailed gynec checkup, including the per vaginum examination. My dear friends, when the examination comes, I am folding my hands. I am requesting you. I have the mobile app. Dr. Deshpande has prepared a very simple and sweet mobile app, which is also called as Ayurveda Academy. Google Play Store. Google Play Store. My Ayurveda Academy mobile app is free download. Please download it. Then it includes nearly 10 to 12 very interesting program with very nominal price. In that, we have the clinical examination type of program where gynecological examination is also shown, how to do PV, etc. So don't forget to download free Ayurveda Academy mobile app of Professor Deshpande and purchase the program of clinical examination. Okay, thank you. Then T3, T4 thyroid test to rule out the hypo or hyperthyroidism, because T3, T4 high, hyperthyroidism, T3, T4 low, hypothyroidism. Now we will go for the treatment part. First prescription by Professor Deshpande and the team. Rule out the exact cause and treat accordingly, because finding the cause is the most important key for any successive treatment. That's why many patients, they make WhatsApp me and asking, sir, can you prescribe these medicines for this, for that, and so many things. But I always advise them, please pay the amount and get an official inquiry from our expert team of the doctors. They will discuss the case, they will discuss all the things, and then we can find out the exact cause. We will advise you the investigation, and of course, Professor Deshpande's guidance, your prescription will be sent on WhatsApp. So there are so many things. It's not a reel, reels and shorts that Dr. Deshpande, okay, he is making, but for fun. But the educational videos is the most important asset of Ayurveda Academy. Very scientific, but very simple language. Okay. Now, the Stiplon is a typical, what you can say, the styptic, very, very pharmacological word, which stops the bleeding, okay, excessive bleeding. So Stiplon tablet, 2 tablets 3 times in a day from Himalaya company. Chandra Prabha tablet, 2 tablets 3 times in a day, which regularize the female reproductive system functions, hormonal functions. Ashoka Arishta, Ashok is astringent. This is Ashoka is a plant, medicinal plant. 4 teaspoons with equal amount of water, which will control the bleeding. Now, my dear friends, second prescription for the heavy bleeding. Here comes Ayapon from Allercine company, 2 tablets 4 times in a day till the bleeding stops. Continue 2 tablets 2 times in a day for 3 months, 3 cycles. Chandrakala Ras, Chandrakala, like a moon, Thanda, Thanda, Cool, Cool, Pittagna, 50 milligram plus Ashoka Churna, astringent, 500 milligram. Then Myfer, 500 milligram, Pravar Basma, 100 milligram 3 times in a day with rice water. This particular Anupan is very good for gynecological cases. Then Nakkesha Churna, 1 teaspoon 3 times in a day. This was the another prescription. Let us move further for the next prescription by Professor Deshpande. U-tone or Abalaga Sanjivani Kalpa, Pramada Sanjivani Kalpa, 2 teaspoon 3 times in a day. For amenorrhea, I am sorry, here is because after amenorrhea, there may be little bit excessive bleeding. So for that cases, Nashta Pushpantakaras, 1 tablet 2 times in a day. Proper rest when there is excessive bleeding, regular and wholesome diet should be there, because then there will not be any vitamin and this type of deficiency. Now we are talking about scanty menses. In Ayurveda, it is called as Artavakshaya. So let us talk about scanty menses, investigation, hemogram and ESR to rule out acute and chronic infections and anemic condition. What can be given? Let us see. First 2 prescription by marking the area. Aluz compound from Allercine company, 2 tablets 3 times in a day for 4 months. Gold compound from Ayurveda Shala to boost up your immunity and take care of the undernourishment. So it will nourishing to your all the dhatus. 1 tablet, it is little bit costly each day with milk. Then Kanya, another prescription, second prescription, Kanya Lohadivati from Hari Parshuram Aushadhalaya. It is the pharmacy from late Vaidya, Khadiwale Vaidya, Pune city, Maharashtra state, India. 2 tablets 3 times in a day. Then Kathaputtali tablet, again very specific medicines from Hari Parshuram Aushadhalaya, Pune. It is very near to my place. So whenever I practice, I usually bring these medicines. 2 tablets 3 times in a day. Kumaria Asava is also specific for gynecological problems. Number 3, 1 teaspoon with equal amount of water 2 times in a day. And then there is a Swamala compound from Dhuta Papeshwar, which is the best tonic for all the dhatus, 2 teaspoon 2 times in a day. So these were the first 2, and next prescriptions for scanty, less menstrual period. This is a Lunare, mild and 4 tablets, 2 tablets 3 times in a day, Lunare, Lunare. Then Rajapravartini Vati from Baidyanath, 1 to 2 tablets 2 times in a day. Prescription finish. Next prescription. These are not the medicines that the patient should take by himself, but this is basically educational video to create awareness how many medicines are there in Ayurveda. Oligo M2 tone 2 teaspoon 3 times in a day. Then Tinapen Charak Company 2 tablets 3 times in a day. Then Karpas Mulasav liquid 4 teaspoon with equal amount of water 2 times in a day. Now we will go for the next problem in the ladies, that is the habitual abortion. Many ladies, they get frustrated when there is a repeated abortions and disrupting the pregnancy and not getting the child. So cervical incompetence, that is most common cause, because there is a cervical os, it should be tight one, its tone should be strong one. If it is not, then the child automatically goes down and abortion takes place. So many times that stitch is made to that cervical muscles, and that os, if there is laxity, os tightening. It is called as os tightening. And a 9-month complete bed rest should be given. Then only this problem can be sorted out. Then there may be fibroid of uterus, retroversion of uterus, anatomical structural problems, bicornuate uterus, the same, hypoplastic uterus, anemic condition, endocrine problems, heart diseases, kidney problem like nephritis, abnormal spermatogenesis may be supporting cause for habitual abortion. Now, what to do? So these type of the investigations you can do for abortion. For example, total gynec checkup, hysterosalpingogram. Hysto means uterus and salpingo means fallopian tubes. Then it is called as a patency test if there is obstruction or any problem in the fallopian tube or the uterus. Hemogram, hemoglobin, for anemia. ESR for the chronic diseases to see the prognosis of the disease. Then acute and chronic infection by WBC. ECG to rule out the cardiac problems. Kidney function test, urea and creatinine to check the kidney functioning is well or not. Now we are going to start the treatment for habitual abortion. Rule out the cause and treat accordingly. Sankhepataha kriyayogo nidana parivarjanam. For cervical incompetence, plastic surgery, as I have said, os tightening and 9-month bed rest. For fibroid, myomectomy, unfortunately, should be done. Treat the underlying anemia, regular and wholesome diet, proper sleep and enough rest. Following the treatment is useful for symptomatic treatment. Leptadine tablet, Allersin Company, 2 tablespoons 2 times in a day. Then lactovine, 2 tablespoons 2 times in a day. We will go further. What are next? Another type of the treatments or the tablets that can be given for the habitual abortion. Shatavarix granules from Jhandu Company, 2 teaspoons 2 times in a day. Shatavari is the best for females for reproductive system, including uterus, ovaries, and also breast. Breast milk can also be increased by Shatavari granules, Shatavari Kalpa or Shatavarix. Then there is a Garbha Pal Ras, very best tonic during whole 9 months. In the pregnancy, each lady can be consumed this Garbha Pal Rasa tablet, very, very fantastic to give the support to the fetus as well as the mother. Shatavari Kalpa, 2 teaspoons 2 times in a day. Trivanga Bhasma, 125 milligram 3 times in a day. Kledanashak. Okay. And Phalagrita is also the tonic, 2 teaspoons 2 times in a day. Now we will go for the next problem in the females, that is called as a white discharge, which is also called as a leukorrhea. First, we will see what is normal, physiological. Every time white discharge is not bad. So normal secretions from vulva, gynecological parts, vagina, cervix, increase under the following conditions. At puberty, due to the hormonal effects, then that is automatically corrected. No treatment is needed. During the ovulation, on the 14th or 15th day of the menstrual cycle, during the early pregnancy, within first 7, 8, 10 days, 15 days, there may be little bit white discharge. During sexual excitement, the excess of secretion is usually enough to moisten the vulva and occasionally pours out to stain the underclothing. Very rarely this staining occurs. Then we will go further. Pathological. What are the pathological causes for the white discharge? Two types. One is general factors and second is the pelvic factors. General factors, health and undernourishment, ill health and there is a printing mistake, ill health and undernourishment, dysfunctional, maybe endocrinal hormonal problems, marital disharmony and psychosomatic. There may be some psychological anxiety, tensions, these causes can be there. Now we will see the pathological causes for white discharge. Now these are more important. For example, pelvic factors. Just give me a few minutes to mark for you because it is always better, always better. Vulval growth and ulcer, vaginitis, ITS is inflammation, cervical cancer, carcinoma, uterine tumor, maybe polyp, maybe fibroid, adenomyosis, chronic cervicitis, cervical erosion, genital prolapse, contraceptives like loop or conventional or oral, pelvic inflammation and pregnancy. These can be the causes for white discharge. Now, which investigations one can do? Such type of investigations can be done for white discharge. Hemogram and ESR to rule out the anemia, acute and the chronic infections, gynecological examination, PV examination, urine routine for UTI, urinary tract infection, to see the blood sugar, urine sugar, that is glycosuria for the diabetes, to see the albumin, kidney problem, stool routine for amoebiasis, giardiasis, or roundworm, threadworm, hookworm, tapeworm. Then blood sugar, fasting and post-glucose or postprandial to rule out the diabetes mellitus or glycosylated hemoglobin, HB1AC. VDRL to rule out the sexually transmitted diseases. Cytological study for vagina and cervical scraping can be done. Now we will talk about the treatment part. For the white discharge, rule out the cause and treat accordingly. If erosion, cervical erosion, there may be cautery can be done for and for tumor, if any tumor in the uterus, of course, the gynecological surgical intervention must have to be done. For the symptomatic treatment, you can use the Himalaya Leucol tablet, 2 tablets 3 times in a day. Please see the video also. I have uploaded many videos on the Ayurvedic medicines and those are fantastic, superb. Please see all the medicinal videos. Then another treatment for white discharge, for example, Ashokarishta Kashaya astringent, 4 teaspoon Kledanashak with equal amount of water. Then Pradara Ripu Rasa. Pradara is a white discharge. Pradara Ripu. 2 tablets 3 times in a day with rice water. Rice water is a very good anupana in gynecological problems. Jasada Basma or Trivagna Basma, which is a Kledanashak, 125 milligram 3 times in a day with honey. Then another prescription for white discharge. Chandra Prabha tablet, 2 tablets 3 times in a day. Kamadudhavati, 2 tablets 3 times in a day. Then Jiraka Arishta, 4 teaspoons with equal amount of water. Shatavari Kalpa, best Asparagus racemosus, tonic for gynecological systems. Then we will see lot of prescriptions I have shared with you. So this is very interesting because I find that there is a young generation and they are searching for the experienced Vaidyas medicines. So Laghumalini Vasanta, 2 tablets 3 times in a day. Sukshma Trifala, 2 tablets 3 times in a day. And Vanga Basma, Kledanashana, 125 milligram 3 times in a day with honey you can give. Then last, you can give the Myron, Allersin Company, 2 tablets 2 times in a day. Pramad tablet, 3 teaspoons 2 times in a day. Then after delivery, one can give, these are the another things. Balanta Kada number 1 for first 10 days. I have the separate video on Balanta Kada. Please see Ayurvedic medicines playlist. You will get hundreds plus videos. All generic medicines, brand medicines, I have discussed. Balankada number 2 for next 10 days, that means from 11 days to 20 days. And Balankada number 3 from 21 days to the next month. Dashamularishta, 4 teaspoons with equal amount of water, 2 times in a day. When there is inadequate lactation, breast milk is not proper. Of course, this I'm sorry to say, but these are something new things. This is not related with the white discharge. Okay, stanya janana. This is a galacol 2 teaspoon 4 times in a day. Then Lactare TTK company 2 tablets 3 times in a day. Then there may be Lactone Baidyanath company 30 gram 2 times in a day. That means nearly 4 teaspoon with the water. Then that is a Stanya Shodhana 2 teaspoon 2 times in a day. Lactovine tablet 2 teaspoon 2 times in a day. And Utone 4 teaspoon 2 times in a day. My dear friends, today we have discussed a lot about the feminine or the gynecological problems, and I hope you are little bit gaining the knowledge of Ayurveda about the from modern aspect, also from the Ayurveda aspect, and that will definitely improve our understanding of the Ayurveda and the modern science step by step, scientifically and also in a lucid language. My dear friends, please don't forget my all-time request. Even if I forget, you please don't forget to press the bell button icon to get the notification of interesting videos, and never forget to subscribe my channel because I want to share lot and lot of interesting videos for you. Please help to my boost my efforts to do such things. Okay, thank you very much. Take care and see you soon.